Good afternoon and welcome to the Social Services and Community Select Committee. So please introduce yourself and your team and make some introductory comments and then we'll move to questions.
Yeah, kia ora koutou. Ko Aaron Jones tōku ingoa, he tū whakarai hau ki te AROTURUKI TAMARIKI. So I am Aaron Jones. I'm fortunate to be the Chief Executive of the Independent Children's Monitor. On my left is Shelley Tyson. She's the General Manager for our Corporate Strategy and Insights team. And on my right is Nova Bannigan, and she is the Chief Monitor for our organisation. So, look, I'm proud to report that in the first full year of our operation as a departmental agency, we have met all of our organisational performance measures. We published our annual report on compliance with the National Care Standards Regulations, Experiences of Care in Aotearoa, and 2 of our own initiative reviews, one entitled Returning Home from Care, and the second Access to Primary Health Services and Dental Care. Most recently, although outside of this annual review year, we published a report that followed up on the recommendations made by Dame Karen Patasi following the death of Malachi Servich. During the course of 23-24, our monitoring teams visited the communities of Upper South Island, Taranaki and Manawatu, and Tamaki Makaurau. Following each of those visits, we shared back what we heard, specifically to tamariki and rangatahi, to caregivers, to whānau, Māori, iwi providers, NGOs and government agencies involved in the care and protection of children and young people. We've had positive feedback about our work by those we met with and those that use our reports in the course of their own work. And agencies who are subject to our reports make commitments to improve things in response. A big change for us in the last year was the expansion of our monitoring to the wider Oranga Tamariki system. We now monitor how well support and services are provided to children, young people and families known to Oranga Tamariki, not just those that are in state care. This ranges from early intervention to youth justice and transitioning into independence. And our team are currently working on our first system-wide report, Outcomes for Tamariki and Rangatahi Māori and their whānau. This will be published in May next year. For those children and young people in the care system, the number of people we hear from and the amount of data we collect and analyse has grown since we first established in 2019. But what we have heard across the country has not really changed. We've seen some improvement in some of the data. We've heard some examples of good practice, but not at the level we'd expected to see after 4 years of monitoring the care system. Ensuring that national care standards are met for children in care should not be difficult. These are minimum standards of care, and the state should be a model parent. For Oranga Tamariki to improve its own compliance, it needs to address how it can enable social workers to do what they are trained to do. Being there for Tamariki, completing thorough assessments and plans, supporting caregivers, and ultimately helping to keep Tamariki safe, loved, and cared for. Much is said about the need to prioritise services across government to help these children. However, we have frequently heard about how this is not happening. The Oranga Tamariki Action Plan was supposed to make things better by improving collaboration and the coordination of services. We are yet to see evidence that this has made a real difference on the ground. Where we saw and heard of collaborative practice between agencies, it was due to individual relationships rather than a system designed to make it happen. Funding is siloed, both within and between agencies, resulting in standoffs about who will pay and where care or services will be funded, leaving the child far from the centre. The doorway to help does not open as easily as it should, and it is children that miss out. Sadly, this lack of collaboration and prioritisation is not confined to children and young people already in care. We see and hear of escalation through the Oranga Tamariki system because agencies didn't work together and provide services and support early enough. Looking ahead, we will continue to make more information available, continue to look for evidence of change, and most importantly, understand why that change has or has not occurred. That is how we learn. We are already providing local data and information to those who work for government agencies and community organisations, pointing them towards improvements they can make at a local level while waiting for change in national policies and practice. In addition, we have funded a data scientist at the Social Investment Agency to help us access data in the Statistics New Zealand integrated data infrastructure. This will enable us to look at long-term outcomes for children and young people that have been in the Oranga Tamariki system, as well as fill in gaps held or not held by the agencies. You'll start to see some of this data in our next Experiences of Care report in February. Finally, I'd like to conclude by thanking everyone we met with this year. We heard from more than 1,800 people, children, young people, whānau, caregivers, social workers, and people who work in government agencies, non-government agencies, and iwi Māori organisations. They share their experiences so openly with us because they desperately want to improve the system for others. I would also like to thank everyone who works for the Independent Children's Monitor for not only what they do, but for the care they show and how they do their work. Thank you.
Thank you, Aaron. First question is Carmel.
Okay, and I think we've got an hour for this hearing, eh? Yeah, so I'm going to throw a whole lot of questions if I can get them all out.
Depends how long it is.
And we do have an hour, so that's good. My first question to you, Aaron, is just a year on in terms of the organisation has been set up. At the beginning, there was a lot of cynicism around the level of independence that you might have as an organisation, and you've had to go out there and you've had to build relationships and earn trust. Do you think that that has improved over the course of the year now that people have seen you in action and the work that you do?
Yeah, I would agree that's the case. We always wanted our work to do the talking for us. And I think we've spent a lot of time building relationships and working with key stakeholders to help them understand the nature of our work. But more than that, we've now been around the whole of the country doing our monitoring, and they've seen us in action, and they have the confidence in the way we do our work, the way that we take the voices of children, whānau and their own agencies and rise them up. And I think there was a concern about whether we would be perceived as fully independent. And while some of those perceptions may still be there, I think people have come to see our reports and understand that we are focused on telling it like it is. And that's what we continue to do.
One of the things with the way in which you were set up was that government can't tell you what not to do. However, if they have particular areas that they have concerns about, they can ask you to pick up that work. Have you been asked to pick up or take up any work from the government because of concerns that may have been raised?
No, not from the former or the current government. In fact, I think we've been fortunate in that the independence that was secured in the legislation, but also in practice. I always felt it would come down to the individuals that operate within the system, and we have been fortunate to have been left at arm's length by government to get on and do our work.
Okay. My third question is just around the system. How is the system going, given that you are the monitor, Children's Commission is the advocate, and the Ombudsman is dealing with the complaints? Is that working, do you think?
It is, and I think we're going from strength to strength. As examples come up in terms of us understanding our roles and working together are increasing. So recently, this year, I used our powers to request information or require information from Oranga Tamariki. I was then able to take that information and pass it on to the Children's Commission so that Claire could do her role as advocate. And also with the Ombudsman, in terms of their investigations and complaints, they are providing us with information around the recommendations they're making so that when we're out in communities, we can understand whether those recommendations are actually being implemented, and if they are they making a difference? So the three organisations are starting to complement each other more, bearing in mind the legislation's only been in place for a little over a year, but I do believe we're getting better and better as working as a collective.
Do you think the changes that we are considering here at Select Committee to the form, your entity, and the Children's Commission are going to disrupt that in any way?
I can talk about our own organisation. I don't think it's going to interfere with what we do and how we do it. That will continue, and certainly how we turn up in communities will be the same. I think what the legislation does is address this concern from some about the perception of the way we look, and I understand that too. And if that is going to help, then that is a good thing.
Okay. You said earlier that there are some areas where we haven't seen nearly enough progress, and that progress has been slow. Are there particular care standards that you've been monitoring that is the case for, that you can kind of name?
Yeah, look, I think what I said in my opening remarks is for the care standards to be met, they require social work to be done. So here we're talking about assessments, plans, being there for young people, listening to them, understanding and helping them to connect to the services and the things that they need. That is social work at its heart. And what we're not seeing is social workers being enabled to do more of that work. Now, if there's a couple of care standards I'd pick out, there is that key one in terms of the frequency with which tamariki and rangatahi are being seen by their social worker. That performance has not shifted over 4 years. And the other one would be the support for caregivers,
Yeah.
crucial, right? So these are the people that are there every day for the kids, and they need to be supported with the information and the help they need so they can care for these kids in the right way. And it is pleasing to see that we have been reporting on this as key findings in our previous 3 reports, and the Minister for Children has picked these up, and she is driving that practice through Oranga Tamariki in terms of making these key indicators for her focus.
That's great. And are there any particular care standards where you think that you want us to know about in terms of progress actually being made that you think is significant?
In terms of progress, there's not significant progress.
And
I think-
any of the care?
I think there's, on the face of it, some of the data that Oranga Tamariki provide show improvement in the number of plans and assessments being completed for tamariki in the right time frame. But when you dig deeper underneath that, what you see is they're using a measure that isn't aligned with the regulations. So they're looking at a 12-month measure rather than 6 months as required by the regulations. And furthermore, when you look at the quality of what is being done, so it's one thing to have done it, it's another thing to have done it well, and then have provided that information to the right people. So what we hear from caregivers and what we hear from children themselves is that plans at times are not complete, and the information may not even be passed on to caregivers. So again, I emphasise there's one thing to look at the data, there's another one to understand the experience. And so in terms of our methodology, we bring both of those into our reports.
Okay, great. Thank you.
Supplementary on this, Laura?
Yeah, I was actually going to supplement on the collaboration between the other agencies that you work with. It's good to hear that they are improving. Do you have any way of tracking that improvement and like a goal of where you want to be as far as working together?
So really good question. I think in terms of the qualitative side of it, we will start to hear less of families, caregivers talking about how the system isn't working well for them. So we specifically ask questions around that, and we gather that information, and we'll be able to start to see a change in the sentiment. At this stage, we're not seeing that. So that's one way of doing it. In terms of data and access to services, a bit trickier. I mean, you can look at the funding and seeing where it's different, but it's actually how that funding is used. It's really in the stories of experience where you understand what is actually happening. So I can give you endless examples about how we hear of, for example, education or Oranga Tamariki at a standoff as to who is to fund. And in the meantime, that young person is not at school. And so they are the ones that miss out. It's not a question of, is there a need? It's a question of who should fund. And I think the settings that we have in government around this are something that could be looked at to make it easier and clearer.
I was going to supplementary just on the relationship building that you've been doing over the last year. And just because New Zealand has a small population and there's very small degrees of separation between many, many people. So I'm just intrigued how you manage the balance, the relationship building with the need to robustly interrogate models of care, allocation resources, etc.
Yeah, I think our kaupapa relies on having good relationships in communities because we don't have relationships with young people, nor with whānau. They do. So we have to hold a trusted relationship with providers, as we do with Oranga Tamariki, so that we can walk through the door knowing that we're going to have a frank and open and honest discussion with Te Kaimahi. Now, I have not had any indication of anyone being reluctant to talk to us. They understand why, and like I said in my opening statement, they want their stories to be told. Now, that is where our emphasis on our relationship management goes, so that we can make sure those doors remain open and people can be free and open to talk to us.
Cool, thank you. So when reading your annual report, I saw on page 13 of the AROTURUKI Tamariki notes that its function now includes monitoring beyond the care system, which you talked about in your opening remarks. So focusing on prevention and early intervention. So can you explain how these expanded monitoring activities have identified gaps in prevention efforts or funding for the 23-24 period? And I have a few supplementaries.
Okay. Yes, so over the year, we'd been to the communities that I talked to in my opening statement and listened to people working in that system about how things are going. We had heard good stories about initiatives that have been set up and were moving ahead. But equally, we heard a lot about concerns around the level of funding and funding changes. And so what it meant about the provision of services. So we had heard from providers who are being asked to do more and more by Oranga Tamariki, despite funding changes in terms of their contracts. Yeah, quite a lot in there. And this will be things that we talk through in our Outcomes for Tamariki Māori report that we'll be publishing later next year.
Oh, fantastic. So that is how you as the independent monitor will communicate these gaps to Oranga Tamariki through this report. And I guess what monitoring evidence exists that these gaps are being addressed?
There's a couple of ways. So I mentioned following a monitoring visit, we share back to young people, to whānau, but also to the agencies themselves.
Yeah.
So we reflect back what we have heard, and this way they can hopefully take action at the earliest opportunity and not wait for those formal reports to be published. So that's one way that we do it. The second part is that, yes, we'll feature in our system reports, which will be annual, but also we have the ability to do own initiative reviews. And so now that we're operating in the system, there's so much that we could be looking at and focusing on. And so there's opportunities to do that through that work.
Oh, fantastic. I've just got one more supplementary. So looking back at the June 23 to May 24 period, would you agree that without adequate prevention funding, the system risks being more reactive and focusing solely on harm after it occurs rather than preventing it before, in the first place?
Look, prevention is an important part of Oranga Tamariki's purpose. And I think we'd all agree that preventing harm being caused is a much better place to be operating than at the other end once the harm has occurred.
Thank you so much.
Hilda, thank you. I might just carry on in terms of those services. So are you seeing or hearing, what are you seeing and hearing in terms of the cuts to Oranga Tamariki's staff and then the cuts to funding for services for early intervention and prevention? So you've talked a bit about what you've heard when you're out in the communities. So those are those ones providing the services. But are you seeing or hearing anything at this stage about the impact of the restructure internally and their ability to deliver on
Yes,
their key objectives?
it's both. So we've been in the Bay of Plenty, the most recent visit, and that has been in the last few months. And we've heard from Oranga Tamariki staff about the impact that changes have had on their own organisation. So roles like community liaison roles have gone that they used to rely on to help connect services together. You've also seen with the significant change in the organisation, people coming into new roles, expertise that had previously been relied upon not being there and new people stepping in, so there's an opportunity and time taken to learn. So it's had quite an impact on their own staff and their ability to deliver. We've heard about vacancy freezes as well on the front line that are impacting workloads in sites. In terms of the funding side, obviously you'll be aware that we were approached by a number of stakeholders about concerns about the process, and I don't want to get ahead of the Auditor General's review, but we are meeting with them to talk to them. But we were concerned at the time, and that's why I requested information from Oranga Tamariki about the nature of the changes and the rationale behind it. I remain concerned about the level of changes and the transparency around the decisions that were being made. But certainly the impact is something that we have heard from the front line. And I'll give you an example, particularly from Bay of Plenty, concern about access to mentoring services, contracts that were once in place not being there now, also services that are oversubscribed and can't take on additional work, for example, blue light in the Bay of Plenty, funding cuts. And so it's not about the fact that the community is telling us there's still a need, but they're not able to connect to the services now.
And just further to that, in your monitoring functions, will you, through those mechanisms, see whether there has been an impact from so-called back office cuts on frontline services within Oranga Tamariki and within the community?
Well, we're looking at it all. So when we go out and try and understand what is happening in the system, we're looking at the things that are impacting on the ability for it to deliver and perform for young people in their whānau. And so if one of those things is impacts around structural changes or staff no longer being there, that is something that staff will talk to us about and we will report on, because that can be a real barrier to progress and success. Likewise, changes to funding.
So when would we see that reporting?
So we feed that information back to communities. We're still doing the shareback report in terms of what we heard in Bay of Plenty, and that will go out to the communities early in the new year. But this information will be contained in our regular ongoing reports. The question is the speed with which we can put that information into those reports, bearing in mind they tend to be 6 months, 8 months after the year. But what you'll see in our care report is there's also a little bit of a forward look. So we don't want to just wait and hear on what we heard in the last financial year, but sort of talk about what expectation there might be for progress into the next based on the challenges that we're currently seeing.
Yeah, because we were told that the back office cuts would not have an impact on the front line. And my concern is that we are hearing it and seeing it in the communities, and like you say, we're going around, but how do we demonstrably show that so that the next lot of decision making can address those issues that they said would not happen? So I understand there is a bit of a lag issue in terms of timing.
Yeah, and that's why in our next care experience report, we'll be looking a bit forward as well in terms of what we're saying. And likewise in our outcomes for Tamariki Māori report, we'll also be having a bit of a forward look in terms of what might have been happening in the last 6 months. So we don't necessarily have to wait for that delay. And as I say, the communities are receiving the information much closer to the time of the visits. And likewise, Oranga Tamariki are hearing from what we are experiencing when we're on these visits as well. Likewise, the police, and also we feed back to education and health in terms of what we hear about the delivery of their services as well. So much more in real time.
Thank you. On a different topic.
Sorry, I'll come back to that. Just new question, Laura.
You should are we going to get to come back?
Well, yeah, as long as we have enough
We're
time.
kind of going all over the show. I just want to touch base on one of your comments you made earlier about social workers needing to be able to do their job. What aspects of that do you find the most important? So is it because they're not resourced enough? Are there like too many regulatory burdens, or what do you see as the biggest barriers to them not being able to essentially fulfill their roles?
I don't want to put my finger on necessarily what the biggest barrier is, but it's multiple things that are impacting on their ability to be social workers. And if you think about what social work is, it's actually being there with the children and the families to help them. And they need to find a way to enable a greater proportion of their time spent doing that. Now, Oranga Tamariki are looking at systems to help support their staff. So it could be, we know that the CIRA system, and I think we've talked about it here, is being very old. They're looking to replace it. That might be one thing that helps. But equally what you see is levels of sign-off within the organisation that are, for example, 8 levels of sign-off to get to make finances available for a family. Now that's incredibly resource intensive. If we think about trying to access services, so social workers working with Ministry of Education, trying to find the right door to walk through to get the funding and the support. Now that takes up a whole lot of time, whereas if the system was geared to prioritise these children in the right way, that would be a time-saving function as well. Another specific example, and I could keep giving them to you here, and don't take much more time, but in terms of funding and support for caregivers, you have whānau caregivers who may be awaiting an approval process. While that's happening, tamariki may be in their care, but the systems don't allow the provision of board payments to automatically go to those families. So you've got social workers trying to find food vouchers, petrol vouchers to support this family instead of the system just being set up to make it happen. So these are some of the things that can be looked at that would free up time for social workers to spend time with families and children.
Sorry, just a supplementary on that. Can you just walk us through why in these 8 levels of authorisation?
I can't explain why there might be, but I think what you see at times is a risk-averse culture developing within an organisation because a bad thing may have happened, and so more layers of approval get put in place. But at times you need to stop and say, have we gone too far, and can we remove some of this, achieve what it is that we're trying to achieve, but also enable our staff to get on and do their job?
Can I just ask, have you seen an example of something, best practice, that could be replicated?
Yeah, I'll give you an example from the Bay of Plenty just because it's their most recent visit. So, when we did our report on those recommendations that Dame Karen made, one of the things we looked at was the intake process at Oranga Tamariki. So reports of concern that come into their National Contact Centre, and then the volume of those that are no further action. Now, always some of those will be, but you saw very high volumes once they're referred to sites. So approximately 50% of those reports of concern that go to site there is no further action. Now, what is happening up in Whakatane is you've got a partnership with Ngāti Awa there. They have set up their own contact centre where the lower level reports of concern are referred directly to them. And what they do is make sure they connect with the providers in the rohi to make sure that someone is going out and seeing that family, seeing that child. So there is an action rather than a no further action. What you see from the Whakatane site is the number of reports of concern with no further action is at 14%. Markedly different from the national average. So there's an example of really good practice. And this is the kind of thing that Dame Karam was talking about in terms of having a well-funded, well-supported community children's sector to support Oranga Tamariki to do its work and take some of the burden off them. So you have the right people going through the door to help those families.
And if I could just ask one more question, I'll hand over to Willow Jean, but just I've noticed you have done 2 reports, for example, access to primary health services and dental care and returning home from care that have been picked up. Do you have a mechanism in place to monitor how that's rolled out, or is
Yes.
that?
Yes, we do. So every year, those are part of the national care standards. And every year we report on that. Now, part of the challenge with Oranga Tamariki is they don't yet have the data to tell us if tamariki are having annual health checks or whether they are going to the dentist. So we are reliant at this stage on qualitative information, the conversations we're having in the community about their ability to connect children up with these services. So we continue to
what would
monitor
your
it.
recommendation be?
We're continuing to ask Oranga Tamariki that this is important and can you please tell us whether these children are having those checks done?
Would it be that hard to collect that information?
Willow Jean.
Thank you. So my next question is around Oranga Tamariki's delivering results for children and wondering if this is one of the things that you are looking at in your monitoring. And I'm particularly concerned about the percentage of tamariki Māori in care for more than 3 months who are being supported to establish, maintain or strengthen connections to their marae, hapu and iwi. The standard is 95%. This year's performance was 42%. And I'm wondering whether the removal of Section 7AA might exacerbate that particular performance measurement for them. Do you look into that one? Have you made any recommendations to Oranga Tamariki around how to meet that 95% threshold?
First of all, it's one of the care standards, so we're looking at it, and it's certainly one of the things that we have conversations with children and with their whānau and with caregivers is how well are they able to connect tamariki up with their hapu and iwi. I think with Oranga Tamariki, there's been a very strong focus on connection with whānau, and actually what you see in their data is an improvement there, but actually the wider connection to hapu and iwi is a challenge, and sometimes depending on where the child and the place that they might be in, the right time to do that could be a question. In terms of what they might need to do to help improve compliance with that care standard, we to date haven't been in the business of telling organisations what it is that they could do. Rather, what we'll do is where we see good practice, we'll heighten our reports and show them. We don't think it's our purpose to be telling agencies what to do. I think they know full well and they're probably better placed to decide for themselves. What we continue to do is let's look at your compliance. Let's hear what communities are saying about what is being done and what isn't working, and we will share that with you so that you can do better.
I think what is particularly concerning about the 42% out of the 95% target is the removal of Section 7AA. So I wonder if you have seen any good practice that might highlight how that may help achieve that. Or the other thing too is that we recently have the Royal Commission's report, and this is one of the genuine concerns of survivors was the impact that being taken into care has had on their identity, their whakapapa connections, cultural knowledge, and so on.
Yeah, interesting. Part of our mandate for our outcomes for tamariki Māori and their whānau report is to report on strategic partnerships that Oranga Tamariki has and will continue to have with iwi and Māori organisations. So our next report, or our first report, will talk to the strategic partnerships between Ngāti Toa and Oranga Tamariki, Ngāpui and Ngāti Kahanunu. And so we've been talking to them about the efforts that they are making to support tamariki in the system to connect with hapu and iwi, as well as their wider whānau. So certainly efforts are being made and we'll be able to share those in our reports. But anything specific to 7AA, no. I'm pretty certain we haven't heard anything specifically about how that is actually enabled or necessarily the removal might impact. What we'll do is keep looking to see whether it's improving or changing.
Just a supplementary on that. So we're required to do 3 annual reports, aren't we? And one of those 3 annual reports is on outcomes for tamariki and rangatiri Māori and whānau. Could you just talk to us a little bit about what that involves?
Yeah, so it's actually two required annual reports, one on the care system and then this one on outcomes for tamariki Māori and whānau. Then our third mandated report is on the system, which is every 3 years. So that's all children in the system. In terms of preparing for this upcoming report, we've worked with strategic Oranga Tamariki strategic partners to understand what they consider the most important things to be talking to in this report, and particularly the types of measures that we should be using to demonstrate progress. So we've worked with them on that. We're continuing to have discussions with them on how best to construct this report. We have been working with, as I mentioned in my opening statement, Social Investment Agency to access some of the data about long-term outcomes. What we're trying to do is show a view of rangatahi that have come out now aged 27 to look at those longer-term outcomes. So you can see what the impact of the system might be, and hopefully if we're changing things when they're young, long-term, are we seeing better outcomes? So that's the kind of story that we want to be able to tell. Now, some of that data is very, do you have a job? What does your education look like? Are you going into hospital when you shouldn't? But equally, we're trying to access survey information, which gives a better understanding of well-being. So do I feel safe in myself? Am I better connected to my family? Do I have a good understanding of what well-being and health looks like? So bringing both of those stories into this report to give hopefully a very accurate view on how well the system is performing for tamariki Māori and their whānau.
Supplementary on Paolo.
Yeah, just a quick supplementary to Joseph's question. In doing all that, what do you see are the barriers to your performance of that role, making those connections and building those relationships?
Yeah, I don't think we've seen any barriers in terms of making relationships. Like I said, people have been welcome to help. And long may that continue. I think the biggest barrier, which I've talked about before, is access to the right data and information so that we can help tell the story. And there are still plenty of gaps.
Thank you. So in one of your reports, Towards a Stronger Safety Net to Prevent Abuse of Children, prevention is a key theme in that. And so what findings in the report underscore the importance of robust prevention services for children's safety and well-being?
In that particular report? I think probably at the heart of it, considering the nature of the fact that it was about the death of a child, it spoke to the need to keep children safe. And so it's about making sure there are eyes on. And like I mentioned, having organisations that are free and able to walk through the door, be welcomed, hopefully, into that home so they can see that child. And that's the critical thing, I think, that report speaks to, and why Dame Karen was saying we need to have a well-funded, resourced child sector so that this work can be done and so they can support Oranga Tamariki in their statutory function. Because the two are quite different in terms of the nature of the response.
And supplementary, how does Aroturuki's Tamariki's independent monitoring reflect concerns about sufficiency of prevention efforts? So especially in the context of funding decisions. So would you agree that like the gaps highlighted in your 4 reports published in 23 to 24 suggest that cuts to prevention funding, such as the 30 million per annum currently affecting community-based organisations, risks undermining efforts to address harm before it occurs?
Yeah. I'm a bit careful to get ahead of ourselves in our reports. So the reports in 23-24 were specifically about tamariki and care, and therefore the services that are available to them. And those reports spoke to challenges that I've already talked to in terms of agencies not able to work together and the ease with which services can be provided. I think, as I mentioned, our first look at the nature of change in this financial year was in the Bay of Plenty. And certainly we've heard from providers, from Oranga Tamariki staff and others about the changes in the level of funding to services. So again, hearing about providers who are being asked to do more despite the fact that funding has been reduced.
Thank you. Just one more supplementary. So what extent does Aroturuki Tamariki's monitoring suggest a link between limited prevention resources and increased reliance on crisis or state care services?
I think now that we're monitoring the system, we're able to look at some of that and the impact. So before just looking at care is quite a narrow focus, but now that we're looking at the whole, and I think over time, you'd expect to see the changes. So are investments being placed in the right areas? And then are they having an impact on a reduction of the number of tamariki coming into care? Are those that come into care and then leave staying safe? Are rangatahi that are coming into the youth justice system, are we seeing a reduction in the seriousness of offending? Now, all of these things are things that we will report on annually in their outcomes, firstly, in their outcomes for Tamariki Māori report, but also in the system report every 3 years. So we will be tracking them and you'll be able to see what change is happening, both at that immediate stage, but then as I said, we're looking at the 27-year-old group as well and seeing how does this play out into long-term futures for them. The hope is if you do something well, and I'll take it back to care, if you deliver care well and provide that child with a safe, loving home, things that they need, then you'd hope to see that their outcomes through teenage years improve. And then ultimately 27, you'd like to see that their long-term outcomes are improved as well. And that's what we're setting up now.
Thank you so much.
Thank you. My question really goes to who monitors the monitor. And it's around how do we assess the effectiveness of the monitoring that you are all doing to getting actual tangible changes within the system. And if I put that, if I use the example of the most recent report on Malachi, where children are no safer today than when that report came out, with all that you've just been discussing then, are you going to be able to demonstrate in those reports basically how things you identified now may have led to these changes that we wanted to see and these outcomes that we're seeing improving? So how is the monitor's effectiveness being monitored?
Yeah, it's a really good question. And I think your use of the word may is really important because lives of whānau are complicated. There's a lot of influences on them. And just because we've done a particular report, drawing that line between that and change is a challenge. We all just have one part to play in improving the system. Now, in terms of the Malachi report and I guess what you might consider our teeth, because we do hear concerns about what's our ability to actually deliver change. This was the first time that one of a report into the death of a young person had been followed up to see whether recommendations have been implemented. And as I said at the time when this report was published, we're coming back. So in the new year, I'll be writing to chief executives for an update on progress against these recommendations. We will publish this again. If there has not been sufficient progress, we will come back again. And we will come back again. Now, ultimately, our role, agencies aren't accountable to the monitor. It requires the delivery of performance from ministers through their agencies and for chief executives to drive that change. Our role is just to not look away and keep looking and keep publishing. That is what we'll do.
Tapai. Yeah, thank you. That's really reassuring. And just a supplementary to that one, like in terms of the experiences of care in Aotearoa, 2022-23 and the Malachi report, even though it came out after the period you're talking about, you would have been doing all the monitoring of that during the period. So some progress had been made in terms of one of those, but still a lot that hasn't been implemented. What do you think are the barriers and systemic issues to those things, progress being quicker and those things being implemented? I
think it's important to think that it doesn't necessarily require a recommendation to have been followed and implemented. What you want to see is that it's been considered and an appropriate response has been done. So it may be for some of these recommendations that agencies decide that this is not the right thing to do. However, these are the things that are, and we've gone on and implemented them. The problem that we saw was a vacuum. So decisions had not been taken. So that's the first step. And then you want to see what's been implemented and has it made a difference. In terms of what are barriers, I don't necessarily think we called out any of those barriers in there, rather than agencies were busy, they were having initial discussions, but they hadn't managed to get it to the level of actually having made a final decision or done any implementation. I don't think we never quite got from them in terms of what the real barrier was. And I think in that report we called out, depends on your motivation to a degree and what is important at the time. And agencies have a lot to consider and there are a lot of priorities, but we are clear that this is a priority and that's why we'll keep coming back to see whether things are being done and is it getting better.
So you're still not really sure what the barrier is to them actually getting to a point of making a decision to implement, but
I mean, I'd agree some of these things you don't want to be done in the heat of the moment. They do require some consideration, but some of the recommendations that she made were quite simple. So getting MOUs between Oranga Tamariki and corrections should not take 2 years to complete. So some of these things could be done quickly, others quite rightly take some time. But the fact that all the recommendations were still outstanding is the concern. There needs to be progress.
Supplementary, Marivina.
Just on that, and you've said it a couple of times about, I'll keep coming back. Aaron, it's to what end? You know, because if you're having to come back at all, there's a resistance there, whatever that might be made up of.
Yeah.
And so, so who would you tell then? You know, it's like, how do you elevate this stuff, you know, so actually you're not having to keep barking on about something which seems obvious, you know, worth doing.
Yeah, I mean, the oversight system has a number of levers too. So, you know, the Children's Commissioner can keep this in the media's focus, in the public's focus, is one way of pulling the levers. Ombudsman too has powers to do investigations that could be done as well. But ultimately, it does require the agencies to move forward. And we are limited in terms of our ability to influence that. Now, that is the challenge. If we are here in 3 years' time, and I have now done 3 reports on this to no impact, there is a real question to say, well, what more could be done here? We to date have not done recommendations in our reports. We don't think those are something that would necessarily be helpful. This could be something we make a recommendation on. But again, the work has to be done by the agencies.
You just, can I further to that one? You remarked before, you know, like you said, you're not inclined to tell agencies what to do, you know. But you also reveal that, you know, there's an 8-step process to get some money to it, blah, blah, blah. They just might need telling. Just saying. You know, like,
they're just going round and round in circles.
And you know, but yeah, if you've got the microphone, you might want to, do you know what I mean?
I know
It's
what you mean.
It's some of the most obvious things are avoided for system. I'm not quite sure.
Well, I think some of the insights in the reports, they take you right up to the line of what is needed. Now it's
What does
what's
it take to
required
go?
still takes some time to think about what we're going to do.
Yeah.
And I think I'm almost heartened a little by the sort of whānau ora approach of working with families is actually you get alongside them, you show them, and then they have to take the step forward. Because if we make a recommendation to an agency to focus on doing this thing, I mentioned before, agencies, they've got a lot to consider. I can make a recommendation to do this one thing. Again, is it going to get done? I'm wary of tick box sort of responses to recommendations. What I want to see is the information in these reports to be taken, to be considered, and then a response generated within the organisation. And I still don't think I need to tell people what to do. I think they know it.
Aaron,
So that's a concern, isn't it?
I suppose.
wait, I've got a question.
Oh, sorry.
Aaron, just going back to your introductory comments around, I think some of the system,
Mine's a
it
sub.
is a sub,
Oh, yeah.
some of the system design, and some of the barriers where there's, basically it sounds like protection of funding streams and lack of integration between departments, if I understood that correctly. I'm just curious about how you analyse that in conjunction with the other side of this picture, which is that Oranga Tamariki is highly dependent on external providers, deliver services, which requires effective contract management. And how do you,
It's a really interesting point. So in the Oranga Tamariki Act, there are sort of two obligations on the chief executive. One is to be an advocate to connect tamariki up to services that are delivered by other agencies. So responsible for being that advocate, as any parent would be in terms of accessing services. Now, equally, there's a responsibility for the chief executive to fund services when they're unable to get access to those services. So it kind of creates I don't know what the right word is, but when they come to the table, people know that, yes, I'm trying to get access to your services, but equally, if it's not able, I could fund. And this is what I meant at the start about a standoff between agencies as to who is fund. We understand there's only so much money in the pool, and there always will be limited funding. But what happens is we get funding sits with education, funding sits with a school, funding sits with Oranga Tamariki. Oranga Tamariki is acting as advocate to try and access that funding, whether it's in the school, whether it's in education. But all at the same time, these people have to fund services themselves for their population groups, knowing that the chief executive of Oranga Tamariki can also fund for those separately. So it creates confusion and a lack of clarity in the system as to who is to fund. And this is what I mean by funding being siloed. But equally, it's siloed within Oranga Tamariki themselves. So when a child's plan is created, there is no funding attached to that plan. There is funding that sits within sites. So there's a reluctance to transfer tamariki to another site when they move, because if you transfer them with a plan, they may not have the funding to support that plan. So you have funding siloed within sites. This creates complexity and difficulty. And this is what I mean by social work, is trying to navigate this to get the services that they need for these kids. And then across that, you have the levels of sign off as well, if you do actually want to try and purchase the services for that child.
I'll just ask one more supplementary. Just how much do you interrogate the ability of Oranga Tamariki to effectively manage contracts if you're telling us also that it takes 2 years to get an MOU with the Department of Corrections?
Well, I think the review by the Auditor General will look into the last funding round and the process and the approach that was taken. And so I don't want to get ahead of that work, and we'll wait to see it in the new year.
Yeah, well, supplementary.
Just a supplementary on that one, and then back to the other topic that we had, this is different.
Yeah.
Oranga Tamariki has to be the model parent. So I am hearing and seeing this is not all Oranga Tamariki's responsibility. Other departments should be funding these things. When they are not funding, those other departments are not funding those things, is it Oranga Tamariki's responsibility to fund those things for the children who are in their care?
And that's what the Act provides for. That's what I was talking about. So the chief executive being an advocate to access those services that sit within the other agencies. But ultimately, if unsuccessful, there's provision for the chief executive to go and purchase those services themselves directly.
Yeah, because
in the same way that a parent would.
Exactly.
So when Oranga Tamariki was established, there was a discussion around, well, actually Oranga Tamariki, what do parents with resources do? They try and access the publicly funded services, but if they can't, then they go private. And that's what you see in the Act, but it creates this conflict in those duties. Right?
So my concern is with the cuts and the explanation being Oranga Tamariki shouldn't have to fund all of these things. The other departments should be funding it. We haven't had guarantees that the other departments like education or health are funding those things. And so nobody is funding those things. And that will come through in your reporting potentially.
So what you're talking about is potential gaps being created because agencies are stepping back. Now, if that is what is occurring, we will see and hear that in our engagements and we'll report on that.
Yeah, thank you. And then going back to the earlier question. Oh, Joseph, you've made me lose my train of thought on that one. Lucky you. You can send it to somebody else if I remember it. Oh, it'll come back to you.
So how does Aroturuku assess the risk that cuts to prevention services pose to the safety and well-being of children currently at risk of being in state care or are currently in state care?
I think in two ways. One is, and again, it's in these system reports that we'll produce annually. You'll see it in some of the information because if the supports aren't there in the prevention space, you would generally expect to see more tamariki coming into state care. Provided that the threshold for that is set at the right level. What we'll be looking at is what supports are in place for in the prevention space. And like I said, also the voices of experience in terms of what does that look like and are the services there. And so I gave that example before about mentoring services not being available in Bay of Plenty as they had been in the past. That's an example. And so you might be able to draw a line between that and the fact that, and like, yeah, we don't yet know the data, but if you're not seeing a reduction in offending rates, it may have to do with that. Now, we won't necessarily know, but there may be a correlation. So that's how we'll start to report on it.
And so would you acknowledge that these risks could exacerbate existing disparities in child wellbeing outcomes, particularly for Māori tamariki and whānau who are disproportionately represented in state care and the system?
Yeah, the fact that tamariki, the whakapapa Māori, are disproportionately represented, and if services and communities, whether they are kaupapa Māori services or mainstream services, if they are not there for them, then yes, you may expect to see more tamariki Māori coming into care.
And thank you. And so is it clear that adequate prevention funding is not just a moral obligation, but actually a cost-saving measure? Because if we invest in prevention, we're going to have that long-term harm reduction, meaning that less kids are in state care.
I agree. I mean, I think I said it before, if you can invest in the appropriate services at the earliest stage, you can help prevent further harm from occurring and certainly prevent tamariki coming into care.
I've just got one more supplementary. So based on your monitoring, can you state definitely that prevention funding cuts will not have a detrimental effect on children and families?
It's quite look, it depends on what services and what's delivered. At the end of the day, what we'll be looking at is, are the right services there in place? Are the needs of tamariki and whānau being met? And are those services making a difference? So are we seeing a reduction in reports of concern for those families and for those children? Are we seeing a reduction of children coming into care? Are we seeing a reduction in levels of offending? That will be the things that help tell us whether it's effective. And likewise, the stories of the participants in the system, are they telling us that the right services are being provided? That will be the test.
New question, Mario Meno.
Just te kahu, the advisory group.
Yes, I have one.
Oh,
You go.
How is that operate? How
Oh,
does that work in the system?
yes,
How do you utilise it?
yes,
What does it do?
yes. So Te Kahui, we meet every other month. In fact, we're there tomorrow. We're going up to Papaʻioio to meet with them because one of the members is resident in Palmerston North. So we meet every 2 months. We update them on the work that we're doing, and they provide us with feedback and guidance around the way that we work, who it is that we can connect with, but also holding us to account in terms of what we've talked about here is our ability to influence the system. So they're very strong on understanding from me, from Shelley and from Nova. What are you doing as a monitor to help drive the change in the system? And so they're very hot on us to do that. I also hear the importance of engaging with whānau and hearing their stories and making sure that they are involved in our work, a very strong focus from them. But ultimately, they are there to help guide our practice, to make sure that it is right, and also to provide feedback from the communities as well. It's another good test for us to know whether we are doing things right. They're very well connected, and they can tell us about how well our work is being received.
Thank you. So I remember what we were on when Maria Meno last had supplementaries, and it was around you basically explaining why you don't make recommendations. The government puts a lot of emphasis on the fact that we have the 3 watchdogs as a reassurance to all of us who have concerns about some of the things that are happening. But my concern is if they're not responding to the reports that you keep repeatedly raising about the issues that you're seeing. Did I hear you say you may make recommendations?
Yeah, we certainly can.
Yeah.
It's just not called out specifically in the legislation, and we can. That's right. And I think it's really important that when you do, it's noticed. And so if you're making a raft of recommendations every year, it just becomes another one.
Mm.
And I think having had, not seen the progress that we would have liked to have seen in care, the drive for us to make a recommendation is getting stronger. Sure. I feel.
Yeah. Kia ora.
Yeah, great, thank you. Nearly done.
We're using
Doing
all our
so
time.
well. Yeah. So your strategic intentions are to enhance the wellbeing of
Yes.
tamariki. And Aotearoa. So how does Aroturuku demonstrate that its monitoring is directly influencing positive systemic changes for children here?
I think because we'll hear it. Ultimately, that'll be the first thing that we see. Data can be delayed, it can be slow to see the change sometimes, but what we'll hear is a difference in the stories that tamariki share with us. Now, look, most of the tamariki we hear do feel safe. They do feel cared for because they are in loving homes and they've got caregivers that are caring for them. But sometimes it is in spite of the system. And tamariki don't often know what more is possible. You're bearing in mind the lives that they have probably led up to this point, and their expectations may be low, but it's the state's job to raise those expectations and then to meet them for them. That is an investment approach in their future.
And just, I think you mentioned in your opening statement that, is it you funding the data scientists in the
That's
social
correct.
investment agency?
Yeah.
Could you tell us a little bit about that?
Yeah, so we had a look at when the organisation was first set up. I think there was a view that we might enter into information sharing agreements with a range of government agencies, gather a whole lot of data, put it into a database and do work with it. Now that wasn't a way that we wanted to go. A lot of that information already sits within the stats information IDI. So it was much easier to get that expertise that already exists rather than build it ourselves, much more cost effective. Social investment agency do that work. They access that data and they are producing dashboards for us that we can now use in our reports, and it's money well spent.
Okay.
Thank you. So what steps have been taken to address the Office of the Auditor General's guidelines on performance reporting, which emphasise the need for measures that assess effectiveness, efficiency and progress over time?
Oh goodness, you've stumped me on that one. I will have to come back to you with some answers if that's okay. Is that okay?
Just leave me
We invite
Yeah,
those.
we have done the work that we needed to do for Treasury around that. You'll be pleased to know. But you've probably seen from our financial accounts that we've obviously operated within our vote. We're always looking to save money where we can. But ultimately, we're also looking ahead to next year when we may become a Crown entity and the change that may occur as well. So,
Absolutely.
And on that note, thank you very much all for coming this afternoon. Really
Kia ora.
appreciate your time.
Really giving you a
Kia ora.
training.
thank you.
Well, good afternoon and welcome to the Social Service and Community Select Committee. Thanks for coming in this afternoon. Please introduce yourself, make some opening comments, and then we'll open for questions.
Thank you, Chair, and warm civic greetings to committee members. Firstly, I just wanted to take a moment to honour Pacific Communities. I want to thank them for their trust and partnership. In Pacific Communities, there are leaders, providers, connectors and families uniting people to create lasting solutions for our wider communities in New Zealand. And the ministry's role as a system leader is to amplify these voices, ensuring that this informs the advice that we give to government and to the programs we deliver. There's clear evidence for that Pacific peoples experience greater challenges and therefore have higher needs in a range of areas, including education, employment, housing and health. Pacific peoples are more likely to experience preventable housing-related hospitalisations. Home ownership is really important for intergenerational wealth, and while 52% of New Zealand own their own homes, only 28% of Pacific people do. And Pacific young people are currently experiencing a disproportionately higher rate of unemployment. Looking to the future, the Pacific population is young, diverse and growing rapidly. We are the youngest ethnic group, nearly 13 years younger than the total population. And with Pacific peoples shaping the future of New Zealand's population, our role connecting communities, highlighting their needs is going to be more vital than ever. The Pacific region's geopolitical landscape is increasingly dynamic, and supporting New Zealand's contribution to building resilience in the region by working with the Ministry of Foreign Affairs and Trade will continue to be important. Over the past year, the Ministry has undergone significant change and transformation. Early in 2023, I commissioned an independent performance improvement review, which provided invaluable insights into how we strengthen our capability and streamline our operations. We underwent 2 organisational changes, and these changes were challenging. We ensured that our funding for community programs was preserved. Throughout the change, we remained focused on achieving impactful results, and I look forward to talking a bit more about those during this session today. With a leaner and more focused organisation, we remain well positioned to respond to the evolving needs of our vibrant communities. The difference we make has an intergenerational impact, and I'm optimistic about the future of Pacific Communities and the Ministry's role in it. I want to acknowledge our staff at the Ministry for their resilience and dedication and commitment. And this includes my executive leadership team who are joining me here today. Firstly, I have Dr. Karina Gray, the Deputy Secretary for Policy and Insights. And next to her, I have Mata Awha, Florence Malama, the Acting Deputy Secretary for Commissioning and Partnerships. And on my left here, I have Danielo Coelho de Almeida, who's the Deputy Secretary for Corporate and Support Services. Whawhatae mo le awa noa, and I'll hand back to you, Mr. Chair.
Oh, thank you very much. First question, Carmel.
It's Tauwhalawa Geraldine to you and your team, and welcome to the committee. I'm going to get straight into it, really. There are only 2 out of the performance measures that are not met, and both of them are with respect to policy advice. I'm really concerned the level to which they haven't been met. And so in your annual report, and unfortunately, when I printed it off, the page numbers didn't come up, but in the government facing work, it says that the quality rating of policy advice, distribution of scores as per the policy quality framework, that your target is 20% of assessed papers score 4 out of 5 or higher. And so 20% being the target. Last year it was 56%, the year before it was 58%. And then in this 23-24 year, it's 10%. Now there is a note under here that states really clearly that you've gone through turmoil, you've had staff cuts. but this is your core business. And so have you been that severely impacted by your cuts that this is where we're at?
Well, yeah, thank you for acknowledging the change process. Generally, it's really difficult to find really good, qualified, experience-specific policy advisors. So that's our first challenge as an organisation. We have made a lot of investment into building our policy team and policy advice, and I'll give Dr. Karina a bit of an opportunity to talk through some of that in more detail. On top of that, we still have contributed a lot of policy insights, and we have over 32 working groups that we're part of that contribute to policy. But I think I'll hand to Karina now.
Yeah, thanks for the question. So if you look at we're a small agency and we only gave 10 papers to be assessed. So that's 1 out of 10 is 10% that scored 4 and above, but actually all of the papers scored 3 and above, which is considered a good quality policy paper. And we got 3.5, the median, 3.5 out of 5. 3.4 was the mean. But we do have a focus on lifting the quality of our policy advice. So we've had NZIER come in and talk to our policy team, and they've given us explicit pointers on how to lift the papers that scored 3 out of 5 to a 4 or 4.5. And that was mainly around risks and just providing a bit more data and evidence into our papers, which is why we've now got a directorate, which is policy and insights. So we've incorporated the data and insights team into our directorate.
I think my concern is that that this is reflective of you've lost 57 FTE. How many of them were experienced policy advisors? And surely, and even the note in here indicates that there is a correlation between the 35% cut in staff that you experienced with the drop in quality of policy advice that you're giving.
Look, I think firstly, the drop in staff or the reduction in staff mainly came from functions that support the business. Very little came from the policy team. Where we did make changes to the policy team is what Dr. Karina was talking about reconfiguring the team so that it can respond to more things and just upskilling them as well.
I think it's also really important to note that this is the first year since 2021 that we've had an independent policy quality assessment. The previous year was a self-rated assessment. So I wouldn't kind of read too much into a drop in the policy assessment because they're two different.
So the self-rated assessment would put you that much higher than what an independent assessment would, based on the numbers? Because I'd be quite worried about your self-assessment process if that was the case.
Yes, well, we've spent a lot of time building the organisation for future success. Part of that is to stop evaluating ourselves because inevitably you do perform better when you rate yourselves. Getting that independent advice means that we've got someone who's not related to our work giving us the critique. It really enables us to target our capability build on the areas where staff need that support.
I'm going to assume that 3 years ago when you got 20%, which is hitting the target rate, that wasn't a self-assessment.
No, but the difference between 20% and 10% is 1 paper. So
Just a supplementary on that. So just to be clear.
I still haven't finished, but you.
Just the 10, you're assessed against 10 papers. 2 of those needed to be 4 or 5 to meet this standard. One of those papers was as opposed to 2. Is that accurate? And but all of the papers scored, was it 3.4 to 3.5?
They all scored 3 and above. So it
3 and above.
It goes 3, 3.5, 4, 4.5.
And just one more supplementary on this. Carmel mentioned that you'd met 16 I think 18 targets, that I think 2 weren't met. That other target that wasn't met, that was missed by 0.1 out of 5, is that correct?
Correct.
So that was supposed to be 3.5 and you got 3.4 instead. Yeah, so I just want to know too, Geraldine, is there any other government agency that lost 35% of their staff when they were asked to undertake cost savings and redundancies were required across the public sector?
Unfortunately, I don't know the answer to that question.
Oh, okay. And also just want to know the 35% cut. So I'm basically, and I feel like the annual report is drawing a correlation between the cuts and the policy advice decline here. But are there any other impacts to MPP that you have seen as a result of losing 57 staff in terms of the work that you have previously been undertaking, whether it be in languages, whether it be in housing, whether it be in employment? Is there any other area where you think that there has been a diminishing of the work program because of the loss in staff that you've experienced?
Look, I think what we have been able to do is really streamline the organisation. So if we were to do more, then we could do with more staff. But at the moment, for what we deliver, and a lot of the change process was about organising ourselves better, we have been able to achieve the organisational results at the same rate as we did in previous years.
And final question, I promise, Geraldine. But do you think that our Pacific community can still have trust and confidence in the advice that you're giving to government agencies, given the performance measures haven't been met and what we see in your report?
Yeah, I think our performance measures have largely been met. What I do know is our teams are in the communities all the time. So we have this really robust feedback loop coming into the organisation. They haven't indicated any concerns with our results. They haven't indicated anything that would make me think that we are not delivering for them. We do get feedback that would be standard about any organisation that delivers, and we into communities, and we try to respond and fix those as soon as we can. Can I just check whether anyone has anything?
I do want to point out that we did get a 4.8 out of 5 for the minister's score. So he really rates our policy advice. And we do get a lot of agencies wanting to work with us because they appreciate not only our policy advice, but our data and insights expertise.
To be fair, if it's the minister's advice, I kind of feel the same way about a self-evaluation. So, you know, I think the policy framework, policy advice framework is really important for us being able to assess government agencies' policy advice. And that's what I would prefer to look at.
And just on that, just supplementary on that is, I mean, do you think people can have confidence in your policy advice given that all 10 of the papers assessed score more than 3?
Well, if I could just say that we take all information and synthesise it. We take the external review, we take the minister's feedback. That is really important, and we have performance processes, standard performance processes, and I think you could be really confident. I know that the team has worked really hard on their policy advice, establishing strong relationships with larger government agencies to make sure that we have the opportunity to contribute to their work, particularly when they have a larger insight and influence over outcomes for Pacific.
Supplementary, Tanya.
Yes, can I just clarify? Thank you, Geraldine. You mentioned before that the drop in staff didn't come from the policy team, did I? Is that correct?
I think it would be difficult to say it came from any particular team. What I can say is that the entire organisation experienced some type of reconfiguration over that period. And so we talked about languages earlier. So while 14 jobs in the languages team changed and moved, what we did create was 24 generalist roles. Part of that is commissioning for languages. We also created a chief advisor language, a principal advisor language, and a senior analyst language. So I don't want to say jobs didn't go, but we did reconfigure it so that the two areas, the areas that we influence, which Carmel is correct, policy is really important. Commissioning of programs is really important, and then the way we organise ourselves is important too.
One supplementary question, if I may. So now that there has been this reorganisation and the organisation is a bit smaller, how has that affected your outcomes? What are we looking forward to now in the future?
Well, I think our results kind of speak for themselves because, you know, we're talking about significant turmoil in an organisation that has, you know, had to achieve savings, but we have still been able to deliver the same, if not better, as the previous year. So I think I'm really delighted with the results that we've been able to achieve.
Supplementary, Tiano.
Kia ora. Just my supplementaries, it follows on the points made by the Honourable Carmel Sepuloni, because I have the similar concerns with, you know, with jobs being disestablished in terms of what that impact will be in terms of outcomes for our Pacifica communities. So my supplementaries are what are the specific key elements of the refreshed capability development plan, and how will they support the ministry's efforts to maintain that high quality policy advice, given out of the, was it 2 out of the 18 that didn't quite meet the mark, policy was part of it. So what's the plan there in terms of capability development?
Yes, okay. Thank you, Tiana, for your question. Look, I just want to be clear that the ministry has two roles. Part of it is providing advice to government on policies and interventions. That's a really, really important part of what we do because it's influencing some of the bigger agencies and contributing to their work programs. The other part is delivering targeted programs. And so the ability for us to really uplift our staff, the staff capability, their ability to work across a wider portfolio has been a really wonderful opportunity for them. But more importantly, some of the stories that we come back, the difference that we're continuing to make, and I'd like to give Florence an opportunity to just pick one, Florence, an opportunity.
Yeah, absolutely. So in terms of training and employment, so one of our key programs is Tupu Aotearoa. And so this program aims to assist Pacific peoples who are not in education, employment and or training to obtain sustainable employment and or undertake further training to increase their skills or qualifications. So I reflect on the 2,900 Pacific peoples who engaged with the program and were able to be placed in employment and education placements through this. And it's the stories, there's so many impactful stories that have come across our desk as a result of this program. But one in particular is of a young lady who grew up on the wrong side of the law and is a single mother to a 3-year-old. And so she, after engaging with the program through intensive work with Tupu Aotearoa staff, she was able to complete a level 2 health and wellbeing certificate, obtained her driver's license, and the team, with the support of the team, applied for a role as a healthcare assistant, where she's now in full-time employment in the Auckland Hospital. And so for this particular individual, it's not only increasing the quality of life for her to be able to care for her child, but it's also having a more positive aspirational outlook on life, which has motivated her to undertake further studies.
Right.
Yeah, and if I could just track back to the job cuts. So what's the ministry's plan to assess the effectiveness of these changes in meeting both the policy quality framework standards and the broader strategic objectives? And I guess what I'm getting at here is if you are finding that certain jobs are not being met because there is a gap, what will you be doing in terms of making sure that gap is?
Yeah, either way.
Did you just cut off at the end of that, Tiano? That gap is not.
I guess the point I'm going for is what plans have you got to assess the effectiveness of all of these changes and meeting both this new policy quality framework standard and linking that to your broader strategic objectives? And following on from that, if there is policy gaps, what is the plan to make sure that that is filled? Will you be calling for the establishment of new roles or whatever? So I'd like you to sort of give us a sense of what the plan is.
Thank you. Look, the way we assess that, the policy assessment framework is not new. All government agencies have to do it. So what we would do is continue to monitor it and continue to work with the teams to make sure that they have everything that they need in order to do their job at a higher quality. At the moment, we're still relatively new through this change process, so it's something we'll continue to monitor. In terms of outcomes and whether it's impacting on outcomes, we have a standard way of measuring and monitoring, and that's around developing investment logics, monitoring our activities and outcomes, and then a measurement table with indicators. If we would face any challenges, then we've got our standard processes for doing that. At the moment, we're still relatively new into this, and I haven't seen any strain yet. But if that were to arise, then we'd raise it in the usual manner.
Just a supplementary on, you mentioned before that there's sort of two key roles. One is policy and the other is operational. And I note that you've met 16 of the 18 measures. Those 16 measures assess your effectiveness in the operational space?
I beg your pardon?
Do those some of those 16 performance measures that you have met, of the 16 of the 18,
Yes.
do they measure the effectiveness of your operational impact?
Yes. Oh, well, I mean, we have outputs that we are meant to deliver on, and we've met all of those.
And sorry, what was the last thing you said?
And we've met most of those.
You
So
met most.
I was going to say all of those, except for the two that have been pointed out. Yeah.
Thank you. Supplementary, Carmel.
And last time the select committee had MPP officials in, and we had the discussion about the staff cuts and the impact that might have on your operational side. And I'm pretty sure at that time, there was an acknowledgement that you would be moving back more to the core function of policy advice. And so as a result of the downscaling, I guess, of your agency, what operational programs have been stopped or have had funding ceased for as part of this shift?
Yeah. So we haven't cut any programs. Any program that has stopped has been time limited program anyway, so the funding was due to stop. Throughout this entire process, we've managed to preserve all the programs that we've delivered on for communities. So we're really pleased with that. If I can just talk about where we have been able to find savings.
Can I just, sorry, Geraldine, don't want to interrupt you, but which were the time limited ones that were no longer funded? Because I mean, time limited, a government has a choice to fund it. So which were the time limited ones?
So the financial capability program, that was time limited funding, but through reorganising ourselves, we've managed to reprioritise funding and still fund that for another year. That's probably the main one.
Yeah, and also PIPA, Pacific Building Affordable Homes, was another program that was time limited and ended in June last year.
So that's been stopped?
Has been stopped.
Okay, so you couldn't find money from somewhere else to continue to fund that?
No, not for that program.
Any other operational programs that had to be stopped?
Not on the top of my head, but all I know the budget went down by roughly about $20 million from last year of time limited programs to the current year where we are.
Okay.
Okay. New primary question, Tiana.
Kirana, I just kind of was reflecting on some of the comments that you made earlier around Pacifica languages, and I know this is an area of great importance to all of our communities. And you talked about how you've kind of moved roles around and prioritized bits and pieces. I wonder if you could give us a bit more on that, in particular how you're going to manage, the health of the language. community engagement. And the third part to that is because it makes sense to me that you would work with other government departments. So what is the perceived link through in terms of this reconfiguration of Pacifica languages through to, say, the Ministry for Education?
Sure, thank you for your question. So firstly, just to confirm that languages capability and funding has been preserved, we've just reconfigured it. If I just talk about what we've been able to achieve this year, the Pacific Languages Community Fund, that has been maintained. We just closed it. We had 216 applications come through. So demand from community is there. Information to communities is going out. There's the Moana Reo Fund, which I might get Karina to talk briefly about.
And thanks, Geraldine. So the Moana Reo Fund is basically to support the development of new Pacific language media products and also support the career development of young Pacific creatives. So that's new this year, and we've received over 200 eligible applications for that. And we've just gone through the process of assessment.
I was wondering about the evaluation piece. With this work that you're doing. So I guess, and what I'm interested in is, because when you talk to people out in the community, it's always around them wanting to do more, but there being a gap in resources. So I was wondering, in terms of the evaluation, whether that kind of thinking is being factored in. And then the other bit I asked about around a link through in terms of a more government-wide approach and working in with, say, the Ministry of Education, who has responsibility for Pacifica education, whether that is part of the mix.
Did you want to continue?
Thank you. So we do work with the Ministry of Education on the Government Action Plan for Pacific Languages. We work with Ministry of Education and the Ministry of Foreign Affairs and Trade.
And the evaluation piece, in terms of the way that you're going to, I mean, if you just set things up, I probably can understand that, but what is the thinking in terms of the way that you assess the outcome, if I can put it that way, in terms of the programs that you are commissioning, and any perceived potential resource gap that there might be at the end of these programs?
Yeah, thanks for that. We've got a Pacific Language Outcomes Framework, and we've got specific key performance indicators. The language program is quite comprehensive. So it includes Pacific broadcasting, free Pacific language classes through the community CPL, the Centre for Pacific Languages. We also, through our Pacific Language Week series, engagement with that over social media. So we've got quite a broad range of indicators that we use, and we're constantly looking at ways to improve. So for example, with the Pacific Languages Community Fund, we realised that we funded quite a few community-led initiatives, but probably not enough money. So this year we've consolidated some of that, and we're funding bigger projects so that they can have a bigger impact.
New question, Laura.
Yeah, so just building upon a little bit upon that, what we've talked about, what initiatives may have been cut. Have there been any that have been extended, and could you give a couple of examples of it?
Well, firstly, I don't know if many of you have travelled through parts of the country during any of the languages weeks, but one of the things that I'm really proud of, travel through the airport and you see almost all the staff in the cafes. I saw one cafe had put all their food labelled in Tongan languages and that kind of thing. So the penetration of the language weeks, particularly in the private sector, has really increased. The outcomes framework that Karina was talking about, we've only just established. It's part of us building the organisation for success so that we can start to address some of the evaluation questions. While we were delivering languages weeks, the ability to prove what we were doing was a gap that we needed to fill. So we'll continue to do that. In terms of things that we've extended, giving the Centre for Pacific Languages a 3-year contract has been really worthwhile for them because been going year on year on year, and it hasn't enabled them to plan into the future, whereas this year, being able to give them a 3-year contract has been something that we've been really pleased to be able to. Small but important for organisations that are doing this work.
New question, Parameno.
You opened up, Kilda.
Kilda.
You opened up in your statement around home ownership and percentage you put, but you built 18 homes. Yeah. Did I hear you say that that won't carry on, that program? It's a time limited one because you've got a target of 85 homes by 2026.
That's correct. So the people who have 2 programs for homes. One is the PIBA, which was time limited and the funding ended in June, but the building of house will continue for the next 12 to 24 months to help us meet the target. And we also have a larger program to build 300 homes at Porirua East, our Valley, which we have $114 million allocated over 3 years for a 10 years program.
Great.
So we do have a couple of programs there.
Just one second. So, but you're down, how many staff have you, if you've lost this many staff, that obviously is a capacity issue. Will you get there? No, do you think you'll get there?
So a lot of these programs, we work with community providers. In actual fact, the administration of it from an organisational point of view really requires one person. The other thing that is really great about these programs is we lean into the Ministry of Housing and Urban Development and Kāinga Ora for that specific expertise around housing. So it's a really good example of us seeking expertise from those agencies that hold it. Did you want to?
Just, if I can just that's an impressive response. If it's one person, you need one person in your agency. I mean, I built 16 homes up in the Kong last year, and that took about 6 people. So, you know, just in close proximity. So I'm questioning whether that's feasible in the reduction of your staff. You're gonna have one person and you build another 85, is it, by 2026?
Yes.
I'm just questioning the reality.
Thank you, and thank you for sharing your experience. We don't actually build the houses, we work with the community providers. So the function that we do is largely contract management. And we have one person that's expert in housing, but a team of 24 that do contract management. The actual building of houses, where it becomes challenging for staff is because I expect them to have really strong relationships with these providers, to go on site and to make sure that they understand what some of the challenges are for them as they're going through the build and that kind of thing. So from a staffing point of view, we're doing well. From a housing delivery point of view, in an organisation that's had 2 changes to be able to get the contracts out to work with these providers to get 18 houses up is significant.
New question, Paulo.
With all of the things that you're doing, and now that you're a smaller organization, what can you speak to your priorities? Where you're looking to go and what more you're thinking of doing?
Yes, well, a smaller, more streamlined organisation means that we have to be quite purposeful in how we organise ourselves. We will continue to focus on the areas of government priority, housing, economic development, education, labour market and languages for Pacific peoples, helping Pacific families to build equity, intergenerational wealth and have stable community connections, creating those pathways out there so that information can come through. And I just wanted to check with the team whether there's anything you wanted to add.
Yeah, I think one of the operational impacts that we're seeing being able to achieve the business development goals is being able to directly invest into all the business fund directly into Pacific businesses. So we're able to invest into 47 Pacific businesses, which created 149 jobs for our Pacific peoples. Part of this investment was to help purchase capital items, which would help to scale the businesses, the productivity and the growth, as well as expand into achieving or obtaining higher value contracts. And as a result, for one of our businesses, Pacific businesses in Auckland, they were able to move the workforce and create from 3 full-time FTEs to 7 full-time FTEs, as well as give the Pacific business owners improved self-confidence in being able to tap into other markets and expansion within the business development space.
Tanya.
Yes, it was going to be a primary question, but actually it's probably carrying on from what you've just said. I always like to hear about the wins. And you've mentioned so many already. Is there anything else that you feel you haven't shared that was a real achievement? And I don't mind who answers, it can be all of you if you want, but it's good to hear what was great about the year.
Yeah, absolutely. I think one of these key programs would have been the Te Loa program, which is focusing specifically on increasing more of our Pacific peoples into STEM employment pathways. In particular, there's a lack of representation in the STEM fields, and we know that this is a growing future workforce or where the demand for jobs are. And part of this program is about feeding that pipeline approach, increasing the number of Pacific peoples, young students to come through and uptake STEM subjects. And so for one of our investments is the Te Loa Community Fund, directly investing into Pacific community organisations. One in particular that stands to mind is in the Central region, where they've managed to harness a pipeline servicing over 10% of Pacific students, who every single one of those students, years 11, 12, 13, are sitting 3 or plus more STEM subjects and passing an impressive 88% pass rates, which is above the national median. So it's the success stories of that and the impact of that in this particular region, which is going to be sustainable. And once we start phasing out like investment, they will be able to become resilient on their own. We're seeing those intangible impacts where it's uplifting and having a real impact of those Pacific peoples and communities around them.
Just supplementary on that, I mean, that sounds like quite awesome actually. But are there some takeaways and that can be rolled out from that to others or elsewhere?
Yeah, I think a real key unique value proposition and the learnings from this particular provider and what they've been able to fill is the gap and the need with the current education system. And it's things such as working in with parents that don't have a lot of time to invest into their children's educational journeys because of longer working hours or not having a safe space for their kids, not in terms of safe space, but a suitable learning environment for their children to be able to study and focus without being distracted. And so those are some key environmental factors that have been picked up, as well as, being able to involve the parents has been really key as well. So involve them in the journey and be able to work in and fit in with all these circumstances and provide that safe space for families to come together and be able to share challenges or pain points, but also walk them on the journey, not only within the community organisation, but also with the school system as well.
Your question, Vanessa.
Right. So just looking at some of the audit findings from the last year, hello, Nick, by the way, sorry. What sort of work is the ministry doing to address some of those audit findings, given there's been some that have been needing to be improved over this time?
Sure. So there were 2 areas that needed improvement, and if I could just address them. The first one was a result of high turnover, and what it related to was the need to recognise and accrue in the proper way, have an accrual process that was recognising expenditure in the right way. Yeah. Part of that was because of staff turnover, but we're addressing that. The second was around performance and strategic measurement, and the feedback was that some of our measures will use census data, and they would like us to kind of get indicators that more annual in basis so that we can promote some of the things that we're doing and measure the impact. I'll get Daniela also. Did you want to add anything there?
Yeah, just a bit on the, Geraldine mentioned around the management control. So, yeah, we had a bit of, again, the computation issues with our software, which does the approve. So this was picked up about auditors. This was already fixed. This was one of the main sticking points. And another area as well, Geraldine mentions, is the performance improvement. So we're already doing some work internally to relook at what information we collect and how does it help us to tell the organizational performance. So there is already work happening in that space. So we are really addressing the recommendation. But also showing there the area which we did well, which was the information systems and controls.
Yeah.
So it was recognized by auditors. We do have good systems, controls, and policies in place for basically financial management. So pretty pleased with that.
Thank you.
You keep going, Geraldine, are you going to continue? I'll ask after.
No, that's it.
That was it?
Yeah.
Oh, yeah. Going back to what I was discussing before a little bit, I just want to know from you, Geraldine, whether or not you are still actively reducing the number of staff at the Ministry for Pacific Peoples, whether that be through attrition or looking for opportunities for redundancies or any other opportunities for cost savings through disestablishing roles or the number of staff in units.
No, not at the moment, no.
And also wanting to know whether what you're anticipating that over the course of the next 6 months, you will be expected to continue to save costs by looking for ways to downscale the staffing that you have.
We're still working through the process for budget 25.
Okay, so there is a chance. Okay. Yeah.
I've got another question. Just how are you working across other government agencies, like, for example, Kai Order, Whakaora, ECA, MHUD, NGOs, etc., to maximise the impact of your initiatives across the housing, health and education sectors?
We have lots of opportunities to work across government agencies. We've already talked a little bit about policy and we've talked a bit about the work that we're doing in commissioning. But I'd like to hand to Karina because her team is one of the teams that is in there all the time. So over to you.
Yeah, thanks, Geraldine. So our Data and Insights Directorate is really focused on deeply understanding our communities. Obviously, we've got a lot of community insights from the Partnerships and Commissioning Directorate, but we want to make sure that the data we have on Pacific Peoples Government is accurate. So we work a lot with Stats New Zealand. We are the Pacific data steward across government. So we work with them to lift the quality of data where we have a memorandum of understanding with them, and we're establishing an all of government Pacific group. We work a lot with Health New Zealand and the Ministry of Health on analytical standards and to make sure they have a comprehensive view of Pacific health statistics so that they can appropriately monitor the system. We're also working with police to help them understand their populations in the police wards. So we do quite a bit of work across government.
And if I can just talk about one new project. So in addition to achieving what we had set out in the financial year, we also stood up a new project called Pacific Healthy Homes. So this is an enhancement to the Healthy Homes program that is currently operated out of Health. They have just finished their evaluation. It's resulted in 18.6% reduction in hospitalisations, school absences reduced by 5% annually over 5 years. And we would like to see those same types of results into Pacific communities because the need is there and the need has been established. So it's enhanced in that it targets Pacific families with one member over the age of 45 who has had an ambulatory sensitive hospitalisation. So this is a new program and we've done over 900 interventions. Some are significant and some are minor, but Warm Healthy Homes has proven to improve outcomes.
Just a supplementary, are there any improvements that could be made in terms of that work across government? And if so, what might those look like?
Do you mean improvements?
With working with other agencies like, you know, for example, Kaingoa Te Whataora, et cetera, et cetera. Are those relations working well?
They are. We'll continue to work closely with them.
It would be a bit problematic if you said no.
Can I just sup on that one? And I just kind of want to get an understanding of how that work, how you are working across other agencies. What's the difference that you're doing in terms of the day-to-day work that you're doing now, which is different from when you had these other 57 or whatever people? Can you unpack what the difference is?
You know, sometimes our work is largely seen as invisible. And I'll take the restoring citizenship, the cross-agency work that we did there. We put information out to communities to support the community mobilisation. So providing advice to the committee. But when the community came in here, this is a foreign place to them. No one saw, unless you know our staff, you wouldn't know that our staff are helping facilitate that process to get people in, to get them through security. It may seem minor, but the amount of time that it takes to make our community feel comfortable in spaces where they aren't traditionally comfortable is what we're expert in.
And just a supplementary on something you said earlier, just around the being the data steward across government. So obviously, you know, Statistics New Zealand have responsibilities in terms of collating data, but I'm interested in how that role works as being this data steward and sharing that data and working with Statistics New Zealand, I'm presuming, but are there other data sources that you draw on as well?
Dr. Green is an expert on this, so I am going to let you talk, but I just want to say that looking at data from a Pacific lens is very different from the lens that other agencies take to it. So I'm going to hand to you before I get myself in trouble.
I mean, it's really important with data. When you look at it from a Pacific lens, it's not just about the stats, it's about why the stats are there. So Stats New Zealand, yes, is responsible for collating a lot of data, but there are also other agencies such as Health that collect the data, and we help them analyse the data. But because we're across government, we can see things. We deeply know our population. So we've got 450,000 Pacific people in New Zealand. We know that it's a diverse population. You know, there's 200,000 Samoans, almost 90,000 Tongans. So we know the diversity, but we also understand the population dynamics. So we're very geographically concentrated, 62% in Auckland. We make up 17% of Auckland's population, but 9% of New Zealand's population. So we can really help other agencies by deeply understanding our Pacific population.
Supplementary, Carmel, on that.
Yeah, just on the data issue, I'm just wondering whether MPP has any concerns about the fact that so many of the bigger agencies that have evaluations, research and insights teams like Health and MSD, who have made good strides in providing ethnic-specific data over the years, that so many of them have lost funding in those teams and lost capacity in those teams, and whether or not you think that will have an impact on government's agencies' ability to report on Pacific in different sectors?
Look, there's lots of places that are doing research. I think this is a coordination issue. The universities have a growing amount of PhD students and academic staff that are doing research into the space. And so how do we become more effective at linking into those spaces that are doing research and evaluation? For us, for example, we have reduced some of that research and evaluation, largely because we think that purchasing the independent view is going to be important.
But all due respect, Geraldine, but so many of those PhD students and university researchers are reliant on significant amounts of data through government agencies. So if there is a downscaling, which we've seen of those insights research and evaluation teams, then how is that going to affect the evidence base that we need for good policy making for Pacific?
I guess time will tell.
Tiana, I couldn't quite tell if you had a question, was it?
No, that was ages ago, man.
Oh, thank you. Mario Menel.
Thank you. I'm, you seem very calm about the fact that you've lost 57 staff. I'm just curious about how you, how is that so? You know, how are you managing it? And I guess operationally as well, because that's capability, that's capacity. I am interested as to how you are so okay about it. Maybe not okay,
Yeah.
but tolerant of it maybe.
Yeah.
I'd be interested to know what you think, how you're feeling about that.
Yes, well, I mean, it has been challenging for the staff and for the staff that are remaining. But I think I stick by that, you know, we have to still deliver for our communities, and we've been focusing on that.
So supplementary to that. So that's why I think I was probably querying before, the reality of the ability to do that. The ability, despite the desire, the ability to do that, which takes people.
So just a supplementary on that, what are the priorities for the Ministry of Pacific Peoples now that it is a smaller organisation?
I think we've kind of talked about, I mean, I think doing what we do and doing it well is going to be really important. Continuing to focus on those outcomes, health, employment, financial security, growing businesses will be important, as well as lifting the capability and continuing to be a place that attracts top Pacific talent into the public service. So I think we've got a really important role to grow Pacific competence in the public service. And I think the ministry is a place where that can happen.
Just one last question for me, just a broader picture. I mean, obviously, our place in the Pacific is really important, and our relations with the Pacific community is really important. Just what role do you have in helping shape those relationships? I mean, don't want to delve into the foreign affairs side of it so much, but you know, as Auckland's one of the biggest, or their biggest, I think, Pacific population in the world.
Yes.
I'm just interested in how that sort of shapes the broader relations across the blue continent.
Well, I mean, I guess the diaspora here is still integrally involved with the home country. And I mentioned the geopolitical landscape before, how important it is for us to support what's happening in the Pacific. I think that, and I'll go back to the restoring citizenship, the number of submissions that came from Samoa was, you know, at an unprecedented level. Part of that is making sure our communities here have the information, and you know, we'll look forward to continuing to support the Ministry of Foreign Affairs in that space.
Okay,
thank you for your work in that. Awhito Te Lava is the member that was shepherding. So,
may I just say one last thing that I'd regret not saying is that based on the mean FTE salaries, we reduced our gender pay gap from nearly 20% to 8.7%. So
congratulations.
Our women are paid better.
I will ask one supplement though, Geraldine. How much did that have to do with the laying off 57 staff and the potential that they were probably not the most experienced in the organisation, given that's often how this goes?
Yeah, no, thank you. I mean, I think you can tell by the presence at Select Committee that we've made really strong inroads into making sure that we have more women in leadership roles. We do have a number of women in the lower tiers, but across the organisation, we've seen more women move into management and